Which glaucoma surgery is best for drainage? Imagine trying to drain a clogged sink. Sometimes you use a plunger, sometimes you need a pipe replacement. The same idea applies to glaucoma surgery, where the goal is to help fluid escape the eye to lower pressure. The most common and effective surgical options focus on creating new pathways for the eye's fluid, called aqueous humor, to drain properly. One of the oldest and most well-known procedures is trabeculectomy. It involves making a small opening in the eye's drainage system, allowing fluid to flow into a tiny bubble called a bleb under the conjunctiva, the clear tissue covering the eye. This surgery can significantly lower a pressure but requires careful post-operative care. It also carries risks like infection or the bleb failing over time, which might cause pressure to rise again. In recent years, glaucoma drainage devices, also called tube shunts or implants, have become more popular, especially in complex or refractory cases. These devices include the Ahmed glaucoma valve and the Baerveldt glaucoma implant. Both have a small silicone tube that directs fluid from inside the eye to a plate placed under the conjunctiva, where it is absorbed. The Ahmed implant has a built-in valve that helps control fluid flow, reducing the risk of too much fluid leaving the eye too quickly, which can cause low eye pressure or hypotony. It tends to work quickly and predictably, making it a good choice when early pressure control is needed. On the other hand, the Baerveldt implant does not have a valve but has a larger plate to maximize fluid drainage. It often results in better long-term pressure control and may reduce the need for medications later on. However, because it does not have a valve, there is a higher chance of early hypotony, so careful monitoring after surgery is essential. Studies comparing these options show that both trabeculectomy and Baerveldt implants can provide similar long-term control of pressure. The choice depends on the individual patient's situation. For example, if quick pressure reduction with fewer early complications is a priority, the Ahmed valve might be preferred. If long-term pressure control with fewer medications is the goal, and the patient can tolerate a brief period of higher pressure after surgery, the Baerveldt might be better. It's also worth mentioning that newer minimally invasive procedures exist, but they generally offer less pressure reduction and are usually used in earlier stages of glaucoma. Ultimately, there is no one-size-fits-all answer. The best surgical choice depends on the severity of glaucoma, the patient's overall eye health, and the surgeon's experience. Consulting with a glaucoma specialist is essential to determine the most appropriate approach. Remember, any surgery requires careful follow-up to manage potential complications and ensure the best possible outcome for preserving vision.